Hi, Namaste and a very warm welcome to this Derm School video. I am Dr. Sujith Kumar, your dermatologist, and today we'll be talking about a disease called as alopecia areata. Alopecia areata is a kind of hair loss where patients tend to lose hair in patches. This can happen on the scalp and sometimes on the facial hair, especially the mustache and the beard, and even the eyebrows and eyelashes can be lost. And sometimes it can affect the body hair also. So before we go into this discussion, I would request you to watch this video till the end because we'll be discussing about what is alopecia areata, what are the different causes of this disease, how do we dermatologists diagnose this disease, what are the different treatment options available, and what should you do if you get this disease or any of your relatives tend to have this disease. And if you have any queries or doubts regarding this disease, you can ask me in the comment box below and I'll try to reply to your queries. And if you want me to make any videos on any particular skin diseases or any skin topics, kindly mention in the comment box and I'll try to make a video on that. So getting into the topic of alopecia areata. This alopecia areata is an autoimmune disease. So before we understand what is this autoimmunity, we should know what is immunity. So immunity is our body's ability to fight against diseases. Whenever a bacteria, fungus or virus tries to invade our body throws a defense against these, and that defense mechanism is called as the immunity or the immune system. Various kinds of cells in the body are the part of this immune system. This immunity is there to protect us from invaders like this bacteria, fungus and viruses. But sometimes what happens is this immunity, they attack our own cells out of some misunderstanding or some misreading, and this is called as autoimmunity. So one important kind of immune cell is the WBCs or the white blood cells. And these white blood cells, there are different kinds of white blood cells, and one among that is called as the T lymphocytes. And these T lymphocytes go and attack our hair follicles, and our hair follicles tend to fall off from the scalp. And this is the pathomechanism of this particular disease called as alopecia areata. So now we'll see what are the different kinds of alopecia areata. When this alopecia areata occurs in patches, or round patches, especially on the scalp, sometimes on the face or sometimes on the mustache and beard, we call it as alopecia areata. But as the disease progresses, more and more hair falls off, and sometimes the entire scalp hair falls off, and then we call this as alopecia totalis. And if the entire body surface is involved with loss of hair all over the body, then we call it as alopecia universalis. Now this autoimmune process can be triggered by various factors like, for example, viral infections in the body, sometimes hormonal changes in the body, emotional stress, physical stress. These are different factors which can trigger such an autoimmune process. So as I told you earlier, when it occurs in patches, we call it as alopecia areata. When the entire scalp hair is lost, we call it as alopecia totalis, and when the entire body hair is lost, we call it as alopecia universalis. This alopecia areata can sometimes be associated with some other diseases. For example, autoimmune thyroid diseases like Hashimoto's thyroiditis. So whenever you go to a doctor with this alopecia areata, your doctor makes sure that you don't have these problems, and they might sometimes order some blood tests for you so that such diseases are ruled out. Sometimes this can be associated with some allergic diseases like eczema, asthma, etc. So these are the diseases which have to be ruled out if you have alopecia areata. So how do we dermatologists diagnose alopecia areata? Alopecia areata is a clinical diagnosis. So we dermatologists classify this alopecias or hair loss into two types. One is called as the scarring alopecia and the non-scarring alopecia. So non-scarring alopecia means that there is no scarring on the scalp. So this alopecia areata is a kind of non-scarring alopecia. Then we look into the scalp, or we use a handheld instrument called as a dermatoscope. We use this dermatoscope to study the scalp hair, or especially in the patch of the hair loss. So we use this dermatoscope to look for a very important finding called an exclamation mark hair. So the hair in the alopecia areata, it looks like an exclamation mark. All of us know what's an exclamation mark. When we write a sentence in English, we sometimes put an exclamation mark. So this hair in alopecia areata also looks like an exclamation mark, being thick on top, and as it comes down, it becomes very thin. So this is a clue to diagnosis of alopecia areata. Sometimes, very rarely, we may need a skin biopsy to diagnose alopecia areata. 10 to 50% patients with alopecia areata tend to have nail disease. And the most common kind of nail change is called as nail pitting. When you closely observe the nails of patients with alopecia areata, you can see multiple pits on the nails. Some other common nail features are, spoon-shaped nails, white color, lines on the nails, nails cracking in between, and ridges on the nails. These are different kinds of nail changes which you see in patients with alopecia areata. A very important complication of alopecia areata is that people go into depression and anxiety, especially people with alopecia totalis, that is complete loss of hair on the scalp or complete loss of hair on the body. They go into severe anxiety and depression. So such people require very good quality counseling for self-acceptance. Otherwise they go into severe depression. I've seen these patients having alopecia totalis and universalis going into severe depression. So this is a very important complication of alopecia totalis and universalis. Now, what should you do if you have this kind of patchy kind of hair loss on the scalp or on the face or on the body? Immediately go and see a dermatologist and find the cause for your hair loss. So this patchy kind of hair loss could be even due to many other diseases. For example, tinea, which is a fungal infection, could cause a patchy kind of hair loss. There are so many other scarring kind of alopecias or scarring kind of hair losses which could have patchy kind of hair loss. So only a dermatologist could be able to look into that lesion and diagnose it properly and give you the best treatment possible. So the diagnosis is a very, very, very important and crucial step. So whenever you see a patch like this, immediately go and see a dermatologist and get treated. Now let's see what are the treatment options available for alopecia areata. So if it is a patchy kind of alopecia areata where the patient has a few patches on the scalp or on the beard or on the body, we dermatologists prescribe certain creams or ointments to the patient, usually which contains very potent corticosteroids, which the patient is asked to apply on the patch, might be around for a period of around a month or so that the hair starts growing back. Another option to treat alopecia areata or the patchy kind of alopecia areata is to use certain sensitizing chemicals or chemicals which cause local allergy or dermatitis. For example, dinitrochlorobenzene is one chemical like that which we apply on the scalp, and this causes an irritation or dermatitis, which then triggers the hair to grow back. So these kind of treatments are the different options which we have topically applying. There's another product called as minoxidil, which is usually used for this male pattern baldness, which we call as androgenetic alopecia. Sometimes this minoxidil is also used in alopecia areata. Another treatment option is to give injections at the site of the hair fall. This is called as an intralesional injection. So we have certain injections like triamcinolone acetonide, which is a very powerful corticosteroid, which is injected directly into the skin. It's called an intradermal injection. So wherever there is a patch, in the patch, we give multiple injections at multiple spots, and this helps the hair to grow back. So sometimes you might have to take 2 or 3 injections with a gap of around 21 to 30 days. And this is one kind of treatment for alopecia areata, which we usually do very commonly, and we get excellent results with this kind of injection. Treating patients with complete hair loss on the scalp, that is alopecia totalis or alopecia universalis, the entire body hair being lost, this becomes very challenging and difficult. These patients may require systemic therapy, or they may have to take medications inside, oral medications in the form of corticosteroids or injection of corticosteroids, which are given frequently. But the problem with these medicines is that they have got side effects and cannot be used for a long time. Recently, there has been some hope with some new medications, like they are called as the JAK-STAT inhibitors, which have been tried in some patients with alopecia areata by some dermatologists, which have shown some promising results. I personally don't have much experience using these medicines, especially drugs like tofacitinib, which has been tried by a few dermatologists, and they've found very good results in patients with alopecia totalis and alopecia universalis. 60 to 70% patients with alopecia areata, especially the patchy kind of alopecia areata, they have spontaneous regrowth of hair, meaning to say that even without treatment, they can sometimes get their hair back. But with treatments like intralesional steroids, most of the patients do get very good results, because I've seen in my personal experience that patients whom we inject with these intralesional steroids, majority of them have very fast regrowth of hair. In some scenarios, the regrowth of hair is very difficult, and we call this as poor prognostic factors, especially if the alopecia areata is of very early onset, especially in children before puberty. And if there is extensive loss of hair, especially alopecia totalis and alopecia universalis, and if there is associated diseases like autoimmune disease, as I told you, the thyroid disease, nail diseases and all, then it becomes a bit difficult to regrow the hair, and these are called as poor prognostic factors. In patients with very less hope of regrowing their hair, dermatologists usually recommend placement of wigs or hair fixation or some other camouflaging techniques like that. If you ask me about home remedies for alopecia areata, I've seen patients come and tell me that they've used garlic cloves. They cut the garlic clove and the wet part of the garlic is applied on the alopecia areata patch, and sometimes this helps in hair regrowth. This works on the principle of irritation, as I told you earlier, where we use chemicals to irritate the scalp or the patch. So here the garlic clove is applied on the scalp and it causes some irritation, local irritation, and the hair grows back. So it's very safe to use this, but be careful that you don't use much and don't rub the garlic clove onto the skin, because sometimes it can cause a chemical burn there. So you can use this therapy might be once or twice in a week, and I don't recommend using it daily, because what happens is there becomes a skin burn which leads into light scarring at that area for some time. This is not an irreversible scarring, but it does last for a few days. So therefore it's better to use it once in a week or twice a week. So these are the few things I wanted to tell you about alopecia areata. If you have any queries about this disease, if you want to ask me something about the disease, please feel free to ask questions in the comment box below, and I'll try to answer them. If you want me to make any new videos on any particular dermatological subjects, any skin disease, please let me know and I'll try to do that. Thank you for watching, and don't forget to subscribe. Please press the subscribe button below and also the bell notification icon, so that you get notifications whenever I post new videos and you don't miss any of my videos. Thank you so much once again.